Health, they said, is wealth. With improvement in the health sectors and many other factors all over the world, many countries have been able to increase the life expectancy of their citizens. For example, Nigeria has 61.79, while UK has 77.4 and the US have 82.2. Meaning, all things being equal, it is expected that a Nigerian is expected to live up to 61 years of age. A number of things are, however, involved to attain this desired life expectancy, ranging from genetics, for example, how long did your parents live before they died. It also depends on lifestyles like how much exercise do you take alcohol, do you take cigarettes in excess. Another factor is your nutrition, how much of salt do you consume, you take lots of highly processed food. Another very important factor is your access to healthcare. Like, how far is your place of residence to a health facility? This is essential when it comes to seeking for emergency service. This is to say that your health is a very important factor that contributes to your life expectancy. In this video, I will highlight some of the investigations that will be requested for and useful as you go for your medical checkup. This is so that you can read about them and ask relevant questions when you are in the presence of the doctor. Some of these investigations are applicable to both male and female, while others are gender specific. I'll start with the generalized one before going to the specific one. Now let's get into it. Number one is fasting blood sugar. This is to check for if you are diabetic. A lot of people are walking around with elevated blood sugar unknown to them. Fasting blood sugar is a basic test that will save you a lot. Getting to know if you are diabetic will help you to make proper lifestyle adjustments, which will save you your kidney, your eyes, your nerves, and prevent you from having overwhelming infection and so many other things. Number two is ECG, electrocardiography. This is to check the electrical activities of your heart. It helps to detect if there is anything going wrong with your heart, guide for further investigation if any abnormality is detected. This is especially important for people with chronic illnesses like hypertension and diabetes. And number three is fasting lipid profile. This is to check for how much of bad and good lipids you have in your body. Bad lipids like cholesterol, triglycerides, low density lipids are implicated in diseases like myocardial infarction, popularly known as heart attack. Number four is chest X-ray. This is to detect if there is any abnormalities with your lungs. This may not be done routinely because of the risks associated with radiation unless you are being evaluated for a particular lung disease. Allow your doctor to make the decision and guide you on this. Other investigations that will be required for you during your medical checkup include liver function tests, kidney function tests, full blood counts, urinalysis. You also need to go for your eye and ear examination. These are two senses nobody wants to lose. So you go to see the ophthalmology and also the ENT surgeons. Now for the test specific for women, we have pap smear to screen for cervical cancer and breast mammogram to screen for breast cancer. For men, it is important to have prostate-specific antigen to screen for prostate cancer. Depending on the disease running in your family, it is important to also screen out for them. For example, colorectal cancer, skin cancer. Once you speak to a doctor, he or she will be able to guide you appropriately. In developed countries where the health sector is well structured, I'm aware at some specific age, the citizens receive notification to go for certain screening. But in underdeveloped countries like Nigeria, where things are one kind, it is important to take the responsibility for your health by going for medical checkup regularly. Once you get to the hospital, walk straight to the general outpatient department where you will find the family physicians and medical officers. The doctor will ask you relevant questions, perform physical examination on you and request for some investigation, the result of which will be interpreted and discussed with you on the way forward. If there is any need for you to see a specialist, you will be referred appropriately. Thank you for staying to the end of this video. Kindly do check up yourself now and don't forget to subscribe, comment and share with your family and friends. You never can know who you are saving with this video, and I'll see you in my next video. Bye.